We're just going to call this Are Surgeons Smart? Or maybe we should just call it Are Surgeons Good Listeners? We're just going to call it Are Surgeons Smart Listeners? I don't think so. And let me explain why. Surgeons of just about any type, we're bright people, we can memorize information, we managed to make it into medical school. And if we did great in medical school, then we went on to do head and neck residencies or plastic surgery residencies or dermatology or whoever the physician is that you're seeing in the cosmetic world. They're probably pretty bright. Now, it doesn't mean they're a smart listener. It doesn't mean they're a smart human. It doesn't mean they're good at interacting with people. A lot of us are terrible at it. I think that a lot of surgeries would turn out better for patients if the surgeons are communicating verbally, listening to patients, paying attention to body language, and asking the right questions. I don't think surgeons in general are great at being smart listeners. So let's kind of go over some of that. For instance, when it comes to the healing process. Now, you've gone in for your consultation, whatever it is, and you've asked your surgeon, Dr. Jones, after my breast augmentation, how long until I'm healed? What's my recovery time? And there's a tendency, or at least there used to be a tendency for surgeons to think of you as this bag of physiology and this tissue, and you're just a chunk of biology with eyeballs and a mouth and a credit card, and you just bought breast augmentation from Dr. Jones. And Dr. Jones will say, well, your incisions will heal in about 2 weeks and you'll have swelling for 1 to 2 months, but you should be fine in 10 days or 14 days or something like that. Now, maybe that's true in breast augmentation. I don't know. I don't really do it, so go ask an expert. But the devil is in the details. Healing time is really about how a person feels about their situation. Now, if you're going in for breast augmentation and you're asking your surgeon when you're going to be recovered or you're going to be healed and ready to go out and do whatever, they're not thinking about the fact that you plan to go to Hawaii with your new boyfriend or your girlfriends and wear a really revealing bikini that you're excited about because you have this new set of breasts you're going to show off in Maui. You also didn't tell your surgeon that you're going to be there in 17 days or 3 weeks or 2 weeks or whatever it is. And you get there, and even though your implants and the appearance of your breasts are going to reduce in size, not the implants itself, but the appearance of the breasts, and you're going to look fine in 1 to 2 to 3 months, you don't want to leave the resort hotel because your breasts are massive and all the swelling hasn't gone down. Your incisions haven't even completely healed. You can't bodyboard. You can't go surfing. You're not supposed to drink too much alcohol. There's a lot of limitations in what you can do when you get to Maui in 3 weeks because you just had breast augmentation surgery. Now, if your surgeon had asked the question, do you have anything coming up? Yeah, you're going to look okay in about 3 weeks or 2 weeks in your sweater over here in Wisconsin, but when you go over to Hawaii and you're rocking a bikini, it's going to be a different situation. Do you wear a one piece or are you going to wear a two piece? Are you going to wear something fairly thin and revealing or are you going to wear more of a sports bra top? These types of questions are useful for surgeons to ask. But patients, you got to think about these things too. You can't just run into someone's office, request a new set of breasts, run off to Ibiza or wherever you're going to go in a few weeks and expect for everything to be totally cool because your activities are going to be limited. You're not going to go parasailing with a new pair of breasts. So, remember that your surgeons aren't smart listeners and they're not really thinking about your life. They're thinking about your surgery and your breasts. So be sure to ask them questions like, is it cool if I snorkel? Is it cool if I go surfing? Or when can I do these things? And then they'll remember, oh yeah, you're a person with shit to do, like going on vacation or going back to work or who knows what. And they'll tell you, oh yeah, no, you shouldn't be surfing. You shouldn't do this. You shouldn't do that. You shouldn't eat these things. You shouldn't take these medications. Healing time, that is one of the things that really gets lost in translation, I think, between surgeons and patients. So are surgeons smart listeners when it comes to healing time? Or are they smart communicators when it comes to healing time? Some are, some aren't, but some of that is on you, the patient.